A new government report is raising fresh concerns about the typical American diet. A CDC study finds that ultra-processed foods still make up more than half of the calories that we eat, even though the numbers have improved in recent years.
Yep, so joining us this morning is Dr. Lauren Snyder from Corewell Health to help us understand what this means for our health and how we might be able to make some better choices. Good morning, Dr. Snyder. We appreciate your time this morning. Can you kind of explain what an ultra-processed food is? I mean, that's a really big word in our day-to-day lives. I mean, I certainly don't know exactly what that means, so break that down for us.
Yeah, so ultra-processed foods are defined by a lot of different groups in different ways, but mainly it's something that cannot be made in a home kitchen and has different additives that help preserve the shelf life or help keep foods more stable. So oftentimes that means that there's more salt, there's more sugar, and there's more fat added to it, but that doesn't always mean it's more healthy, so it's complicated. So ultra-processed foods could be something like a Cheeto or like a very greasy, deep fried, churro wrapped hot dog, I think was one of the pictures I saw on one of these reports that I was looking at. Or it could be a whole grain piece of bread with peanut butter. There's a wide variety of different foods that are labeled ultra processed, which is why it's so complicated to interpret these results.
I was going to say, it seems like it's like a kind of a fluctuation on what is, you know, could be healthy or what's not healthy. You know, it's very ambiguous, it sounds like.
Yeah, to kind of give people an idea, a bit of perspective, when we're talking ultra processed foods, we kind of have that idea of, oh, maybe Cheetos, Doritos, something like that. But what would you say is something that's not included in ultra processed foods that people might be thinking of? Because whole grain bread, I would have thought that that would have fit into the non-ultra processed food category.
Yeah, so ultra processed foods, the study we were looking at before, the biggest ultra-processed food source was sandwiches, which I thought was really interesting because sandwiches can be incredibly healthy, or they can be something that has a lot of low nutrient food sources. So I think the most important thing is to look at the type of ultra-processed food and see if it's something that has a lot of sugar in it, a lot of non-nutrient type foods, so things that aren't giving you fiber, things that aren't giving you vitamins, things that aren't giving the kind of protein or calcium that your body needs, and making sure that you're not filling up on those solely. So a lot of the things that we looked at in those studies were, by we I mean the doctors and the scientists who are reading these reports from the CDC. We're looking at the things that are high sugar drinks, high deep fried foods, and not just trying to look at ultra processed foods as a whole, but how they can fit into the diet and making sure that it's not dominated by them.
Interesting, and it's kind of like one of those things you have to like look at the labels, kind of weigh that. I mean, that's why they include those nutrition facts for you to kind of look through that. The report says that more than half of our daily calories come from these types of foods. I mean, were you surprised by that number given kind of what you see as a doctor on a day-to-day basis?
So I wasn't necessarily surprised because I think about what is an ultra processed food and what isn't. And basically something that's not ultra processed is anything that comes from a tree, a plant, raw meat. There's processing that has to be done to make food safe. And most of us don't have the time to be getting that food and eating it right away without some sort of processing that keeps it safe in our kitchen or our pantry for more than a few days at a time. So the American Heart Association just came out with a new study this week, which broke down processed foods and ultra-processed foods into healthy, less healthy, very unhealthy, and I really liked how they were doing that and making the types of food more approachable for families, because the biggest change to ultra-processed foods for a lot of people is making foods last longer, making that budget stretch a little more, because you can't buy foods for your family and have them spoil in 3 days and then have that whole paycheck go right down the drain. So you need processing of your foods to make them last for longer.
Interesting. And, you know, I like how you're bringing up this Heart Association graph, or if you will, that kind of breaks the two down. That way you can clearly kind of see examples of what you might be able to choose versus other foods might help somebody in their day-to-day lives.
Yeah, absolutely. And finding balance too between processed foods and then also, of course, trying to get those fresher things. But I really like how you brought up too, saying saying, well, you can't have food that goes bad in 3 days. And sometimes it's not as easy for families to be able to get these really fresh ingredients. You need some type of processing here. How does that balance work in families nowadays?
So I like to find foods that people in the family will enjoy, and if they're not going to enjoy it right away, finding safe ways to preserve it. The freezer is my favorite way because you can put it there and it will stay as healthy, sometimes even healthier if you get fresh fruits and veggies that are frozen at their peak of freshness. And if you put it in the freezer, you often don't need to add some of the extra salt or sugars that are typical preserving agents. So getting food and then freezing it for later is a great way to preserve it. And also being realistic. A lot of times we'll go to the store and we'll say, I'm gonna eat all of this spinach and getting this huge bag of it and then just kind of watching it slowly go sad. So I'll put that in the freezer and then cook it later as sauteed or in a soup or put it in a smoothie. Even though when it thaws, it's never going to taste good as a salad, you can use it in different ways and make that food taste great later when you've preserved it yourself in the freezer.
That's actually a really good tip. I find myself a lot when I know that my meat at the end of the week is going to go bad and I haven't used it, I'll just throw it in the freezer and just make sure I extend that shelf life a little bit without having a preservative in there.
Definitely.
So I hear you talk a lot about the sugars, the salts, you know, the saturated fats, but low in fiber type foods. Why is this combination specifically detrimental to a diet? Can you explain that for anybody listening at home?
Yeah, so our bodies really crave salt and sugar. It's one of the things that evolution taught us to do. So we would find food and we would eat them so we could survive famines. But now that we live in a society where most of us have access to foods that's very high in sugar, high in salt. These foods that are hyper palatable, people will get more of and they will just crave more of them and go back to them more and more. And that's why so many people struggle with being able to regulate how much food they eat and the types of food that they eat. So I'm really trying to make sure that you're limiting those foods that are very high in salt and sugar and very high in fat and trying to have them be something that just complements the fresh fruits and vegetables. So a good example, I think, is something like hummus, which is an ultra-processed food. And it's delicious. It's got fiber in it, it's got healthy fats, but it's got a lot of the characteristics of ultra-processed food. So when you eat your hummus, you want to have it with fresh vegetables, maybe have it with some whole grain pita or some chips, but you want the majority of that to be those foods that are minimally or not processed at all, and then accenting it with the healthy fat and the fiber in the hummus.
Interesting, kind of having that delicate balance between all of those things. Yeah, that's interesting. And of course, a lot of people I think might be a little overwhelmed when they start to try to make diet changes. You know, sometimes maybe going through McDonald's and getting that small fry as a snack might not be the best thing for you. But what would you do if you're trying to make some diet changes? How can you start small and then grow?
So I think that you want to be realistic, you want to be gentle with yourself, and you want to say, what do I already enjoy? If you like that small fry at McDonald's, realistically, a small fry every now and then isn't going to be that much harm, but saying, what else do I enjoy that's maybe crispy and salty, and can I replace that? Or do I really enjoy carrots, and can I work that into my eating routine with something else salty, like some ranch dressing or something else? So finding the fruits and vegetables that you enjoy and really trying to double down on that, and then complementing it with other foods. If they happen to be the ultra-processed ones, and trying to limit that percentage, because 61% of the American diet was the number that they cited in that source. So if you can get that lower down to 20%, you're doing a huge benefit to yourself.
Okay.
Yeah, so that 61%, going back to that report, was that surprising at all to you at first, or was that kind of something that you saw and immediately thought, yep, that makes sense?
So it wasn't surprising to me because we live in a busy society and most of us don't have time to be making these meals from scratch. If we do, they're going to go bad in a few days because you have to have some sort of preservative in a food to make it last longer. So I think that unless we have a society that really commits to making accessible food for all of our people in our society, regardless of the kind of food that they have access to. I know a lot of my patients aren't able to get to grocery stores. They're not able to readily get home after working 1 or 2 jobs and then get that food. The fresher foods or even the high quality frozen vegetables can be really expensive. And then people who grew up in ways where they don't necessarily know how to prepare them, it can be really overwhelming. So we need to have that commitment to making that food accessible and affordable to people.
Yeah, I've seen a lot of different initiatives trying to help make that food accessible, especially here in Kent County as well. I've seen that a lot in many different places. Another group that probably is a little bit more on the high processed food side are kids, obviously. You know, we just got through summer break. We're getting ready to go back to school for many next week.
Yep.
How, as a parent, can I guide my child's diet when we're in the cafeteria lunch line and we're making those decisions? What might you say to a child that is looking to make some of those diet choices a little bit better as they head back to school?
Yeah, so the more familiar kids are with different foods, the more likely they are to incorporate them eventually. You need to be patient with your kids and have them continue to try more foods. Also, the more involved you can get your kids with preparing the foods, with picking out the foods, with shopping for the foods, the more likely they are to want to try them. And just reminding the kids that just because they don't like them now, that doesn't mean that they're not going to like them later.
Yeah.
My husband's a good example of somebody who did not have a very adventurous palate when he was younger, and now he loves making Brussels sprouts and other vegetables that as a kid he would not eat anything that wasn't close to the color of this couch here. But tastes change over time, so you have to let kids have that opportunity to explore.
Yeah, I'm definitely one of those people. My mom was so proud of me when I had my first salad in college.
Yeah.
I was eating chicken nuggets on like, it's a whole thing. And now I eat asparagus, so I'm very familiar. Oh, thank you for the clap. We
The little
appreciate it.
clap.
Yeah, we're like, hey,
Yes.
good job. But yeah, being supportive and also making those good, healthy, conscious decisions is going to be key as you look to kind of eliminate or maybe cut back on some of those ultra-processed foods.
Yeah.
Dr. Snyder, we appreciate your time this morning. Thank you so much for your information and your insight on this topic.
Yeah, thanks so much for having me.